I hate when stem cells are explained as they become the cell. So let's say I have a lack of bone or a lack of something, put stem cells in and they go to the area and they become it. And that's not true at all.
That's what my knowledge was before talking.
They start the process of your body making more of it. And that's important to know, because when you think that they're just going to go in and replace it, you think of it as a much easier and more simplified way, but it's not. It's going to take time, and it's a more complex way. And so you got to understand that, because if you, let's say, you don't have any cartilage in your knee, and it's like, all right, I've been putting all these stem cells in there. Why isn't it turning into cartilage? And it's trying to start that process, but it's not working. So why would that not happen? Let's say you have a crap ton of inflammation. You eat like shit. You don't work out. That process isn't starting because you're unhealthy. Versus, hey, it doesn't matter how healthy you are. I'm going to put these stem cells in there and they're going to become cartilage. No. So that's important to know why stem cells would work in a different way maybe than exosomes, and you got to understand all of that. So
and you can't just rely on just the stem cells itself.
No.
That's where all these other lifestyle factors, which I know we've touched on numerous amount of times, comes into play. Food for thoughts.
You're right. If you're a smoker, you're going to have poor skin health. Exosome treatment's only going to get you so far.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the functional.
Welcome back, everybody, to the Functional Code, episode 28. We are starting our Regen series. This is where we're going to dive a lot deeper into stem cells, exosomes, and how they're being utilized right now in the clinical space. It's going to be great for physicians that are interested in learning more about this, but it's also going to be great for patients and just anyone else listening out there who have maybe wanted to use these products, but maybe not quite understand how they're being utilized and where they should get started first. So to get started, I am Dr. Addy.
Ooh, and I'm Dr. Jace. Super excited to bring this one to you guys, especially with half the stuff in the medical space where certain physicians might not be able to find certain answers. There's all this newer regenerative medicine research and tools that aren't necessarily being utilized to the fullest ability as a full spectrum in our healthcare model. Yeah, as we go through, there's going to be things that might perk a couple questions that you guys may have. So if so, leave it in the comments below.
Absolutely.
We'll get to all that. But yeah, as we go through with some of this regenerative medicine, especially with stem cells, exosomes, we're also going to go into other things in terms of finasteride, minoxidil, some things to use, not to use. So we're just going to dive right in. We're going to take Dr. Addy's brain, since he's been in this space for so long. He has so much knowledge that we're going to get a lot from this. So as we go through, we're going to start off a little bit with what are med spas and aesthetic places, and just even certain medical facilities. Where are they using some of this stuff for? And then we're going to dive into the actual specifics of exosomes, of stem cells, and how are they being utilized and what are the mechanisms, so you guys can understand at a deeper level.
Yeah.
But we're going to try to talk mixture of layman's terms, and we're going to dive a little bit deeper into a few topics. So, Doc, this is going to be fun, man.
This is good.
Exosomes, stem cells used in med spa and aesthetic spaces.
Yes. So there's a lot of movement going on in these spaces right now, because they're trying to take what we have as far as best literature and trying to apply it in a way that makes sense, but also there is definitely clinics that are on the forefront of experimentation, but experimentation done in a very appropriate manner. These doctors, they're very smart. They understand literature. They understand what the literature states, and they understand how to use these products appropriately. So right now, I would say the biggest use in this kind of space is being done on skin, hair, and wound healing. So when it comes to skin, these exosome treatments that are being used are for anti-aging, anti-wrinkle purposes. They're used to help rejuvenate the skin, make it look younger, make it look more clear, less blemishes, those kinds of things. And it works incredibly well. The second thing would be with hair loss. It's not only to prevent hair loss, but to improve hair growth, to make the follicle hair, or the hair of the follicle, stronger, and to improve just that overall look, thinning, those kinds of things. It's even used with patients that have certain types of pattern baldness, like alopecia, whether that's from an autoimmune issue, whether that's from just male pattern baldness. There are things that exosomes are being used when it comes to not only just an aesthetic look, but also a clinical disease look as well. And then lastly, actually I should say, a lot of providers right now are liking it for post-operative recovery. So when they do like a laser treatment or something where the skin tends to maybe look more red or have a obviously puffiness, inflammatory component to it, they will sprinkle or pour on the exosomes after. And I got to see this in real time where someone had done a microneedling session on their face and all over their neck.
Wow.
And it was similar to what is called a vampire facial, right? So they microneedle the face and there's just blood everywhere and it's very red and puffy, and that also helps to stimulate a lot of things, increase blood cell death, turnover, blood flow, and then when it heals, it looks incredible. Now you take exosomes, you put that on, and it only benefits it. But what I saw in real time was their redness went away almost immediately, and within 5 minutes it was almost gone. And the provider who was doing it said that they had never seen that before. And I'm going to use exosomes on every treatment after this now. I've never seen this before. I've never seen something heal so quickly. So I already knew by that time that this was going to be utilized somehow, some way. And so lastly, even some of the bigger spaces that it's getting into is wound healing. And so I've been hearing this for a while now, but that's one place of research that's being done more than others is skin healing. So there's been a lot of research done on diabetic ulcers. There's been done on like pigmentation, just anything you want to heal, scarring, anything you want to heal when it comes to, I guess, harsher changes of skin conditions. So I remember one provider explaining to me that he had a patient that had a large laceration in their leg, and he had done a couple exosomes treatments, and this was just within a week or two. And that laceration healed, he said, quicker than he's ever seen a laceration of that size heal. He said normally it should take about 8 to 16 weeks. Okay, sure. And I think this one healed in 2 to 3 weeks with 2 treatments. And he said, I've never seen something like that heal so quickly. And I hear that often. I've never seen something heal so quickly. And so I can't wait for it to start being utilized in things that need to be healed quicker, that we have that ability to do, to prevent scarring and to prevent further either aesthetic look or even just skin damage. It's getting sunburned. I think inhibiting like photoaging damage is something that this is going to be used on a lot. Patients that have been in the sun and they have sunburn and it's really bad, putting that on it to see if it heals quicker and you don't have those effects. Or if you have damage, that can actually reverse the damage and take away a lot of the blemishes, pigmentation that you get from too much sun damage. And there are definitely literature to show the ability to reduce hyperpigmentation when it comes to these kinds of things. So that's where a lot of the space is taking these products and going. And I can't wait to see what we get to in the next 5 years as far as protocols, as far as being able to take patients and understand, okay, this is actually what's going to happen versus we may think this is going to happen, but here's our best guess is what we're going to be able to see.
Man, that's so cool. There's so many things, like as you're going through right there, I'm thinking, okay, so where are the locations, obviously, from deeper layers of the skin, and even the communication to the brain, nervous system, but even growing up from there in terms of the top of the skin to the hair follicles. So it's a lot of all layers there. And I'm sure there's even a systemic effect as well.
Yeah, of course.
Which is a whole nother thing. But man, God, there's some things I wish they would talk about more in our everyday society. But I think there's obviously, without maybe enough research, obviously, where it's not being allowed to be promoted or put mainstream, which I know we're running into with some of the content we're trying to put out. But man, so as we dive into even more of specifics with, let's say, exosomes, I guess let's start there. What are the key components to that aspect? Because I know in previous podcasts, we know as exosomes are enhancers, as helping any other drug that it's combined with to do its job at a better level.
Yeah.
So let's dive into where the key components, where the functions, and why should people look to utilize exosomes.
And so you take a look at what is an exosome. It's just a very incredibly tiny, small cell. It's acellular, I should say. And its function is to signal. So it contains a mixture of proteins, lipids, RNAs, and it's important to know, I'll get to in a second, why that is important that they carry those things. But they take them and they use that as a vehicle to get to another cell, and then, of course, exchanges information so that cells can then communicate with each other. Obviously, if they're trying to work together to either heal or create some type of hormonal change, other types of reasons why cells need to talk to each other. That is why exosomes are so crucial, is because they are the way for other cells to communicate with each other. And when they are a vehicle for these kinds of things, there are, like I said, there's three things that they carry. So number one would be proteins. Another major protein that I think a lot of people know are growth factors. Growth factors are proteins. And so when they are carrying growth factors to the site of injury, that is a huge reason why exosomes are helpful when it comes to skin remodeling and skin repair and anything else you would want to get growth factors to. Other things like collagenases, which help break down collagen if you have scarring or if you have anything that reasons why you'd want a collagen matrix to break down, they carry that to the site. And then lastly, there's just other signaling molecules, that other proteins that they carry. But secondly, they have lipids. Lipids are helping with the membrane of cells and the membraneity, the integrity, all the things that help create a healthy cell membrane, which is important. And then lastly, the RNAs that they carry help to create any change in gene expression if needed. So making sure if cells should change any gene expression of turning on, turning off, these are what exosomes can help create that communicative line for.
Okay, so if you were to take that understanding, what would be the 5 maybe main functions that exosomes have as communicators or as just a cellular type of being?
Number one, it is for sure communication is their prime. But number two would be their ability to modulate the immune system. And so you have these possibilities of them carrying antigens to immune cells that can then participate in the activation or suppression, if needed, of the immune system. Let's just take, for example, this would be exosomes that are derived from tumor cells can suppress immune activity to aid in tumor evasion if an exosome from an immune cell can stimulate immune reactions against pathogens and tumors. The problem is we think of exosomes as their own thing, but we forget that all stem cells can create their own exosomes. And so exosomes can come from many different cells. And a lot of other cells create those types of cells for that purpose of communication.
Naturally.
Exactly. Yeah. You have tumor cells, anti-tumor cells, that create the exosomes to help aid in suppressing other bad cells. Simple as that.
So is there not enough of those produced by the human body?
As we get older, they have reduced, and so we don't have the ability to have as much of stem cells in the body as we age. And so that's one of the theories, is as we are aging, cellular senescence is happening. We have more die-off, we have less healthy cells, which means we have less stem cells, which means we have all the things we've talked about when senescence happens, such as now we get older, our skin looks worse, we feel worse, and trying to keep up on this understanding of the fountain of youth. How do we get there? Do we inject more exosomes into our body? No. But if we want to help aid in a lot of the things that we know exosomes can help with, that is the reason why we have that ability.
Number three, again, it does help, though, with the ability to contribute to cancer progression and metastasis, because I think this is one thing that a lot of people need to understand is exosomes can help transfer a lot of these oncogenic factors and actually increase drug-resistant genes to other cells, aiding in tumor growth and resistance to therapies. So they can almost get hijacked in a way to aid in the growth of bad cells, because again, they're just signalers. So that is where a lot of the times, if you do have cancers or metastasis, stem cell therapy is usually a contraindication for that theory. Now, there have been arguments to that theory because, like we have talked on before with Dr. Riordan, who literally took the cancer cell, put an exosome in with it, let it create anti-cancer properties, and then inject it right back in, and he showed regression of tumor sizes. So you have these theories, right? You have this literature, and then you go take it into clinical, and then it's 180. And that's where I think this barrier of research and clinical tends to happen. It's like we find in the literature or in theory of what could happen, and then you take it, or you don't take it at all because you're so afraid. And then you have experiments done, and now you have a completely different understanding of what this product can do or what this cell can do.
So just even on that front, because I know if someone was listening to this right now, they would be asking, okay, so why isn't this incorporated into everyday practices, especially if they have cancer or tumors of any sort? Is it that we just don't have enough literature in human trials? Is it early? I guess, what are those barriers right now, and why?
And really the biggest thing would be, number one, I think lack of education, lack of knowledge, and more research will need to be done, unfortunately, before this probably becomes anywhere near mainstream. Cell therapy is taken off, and I think it's going to become, I would say, quite substantial in the next 15 years. And that's going to be exciting. But before we wait 15 years for this to take off, that's where a lot of providers have the ability to practice medicine and practice with it without fear, because a lot of people fear that using these products are illegal, which they're absolutely not.
Unfortunately, the FDA states you can't market these products. That is what's illegal. So yes, unfortunately, if you want to use these products in your clinic, you just can't tell anyone about it. But if you wanted to use them on patients, and if you understand how to use them, it's not illegal, and you can. But why is this happening? Because I think there is a lot of red tape around this basis of topic, and stem cells, exosomes, will never be able to be patented as a drug because they're a human product. So there will always be what's considered a human cell tissue product, which is an HCTP product, which is filed into the FDA as that's its own product. It's not a drug. So basically they're trying to state that these products are drugs versus non-homologous use products. So homologous use products, meaning you take the product, you don't manipulate it, put it in a vial, and you can use it homologously. So you can argue that there's no manipulation, meaning it's not a drug, and you don't have to put it through clinical trials, and you can use it homologously. And a lot of people are trying to get this argument that they are drugs, they are manipulated, and you need to then take it through a clinical, how many stages of clinical trials, and then you need to make it a drug at the end of it. And that process is so expensive that labs that are doing this just would never be able to afford to make it a drug. And that's the barrier right now, is trying to have that argument that these are not drugs. We don't need to go through that process. Now, a lot of providers would argue that they should, because they always just want that little comfortable nest in their body saying, yep, it made it through all the stages and I don't have any worry through that. And maybe patients want that too, but if you do want that, just think, you may not get these products for 10 years then.
Yeah.
Just know that's how long it might take.
Peace of mind versus results.
Yeah.
Or both at the same time,
right.
Just the buy-in makes sense.
So that's my problem. I don't want to wait that long to help my patients. I've done this enough, and I'm confident enough to know that we have very little, if not any, side effects with these products, and the results are really great.
That's so exciting. So after, obviously, with exosomes helping with cancers and tumors, is there other things, because I know in terms of the tissue repair, with wound healing, obviously it'll play effect on that, but does it also help with waste products and just even the management of re-regulating the body?
Absolutely. And one of the ways that it can do that is it can help actually remove unwanted toxic materials And so they somewhat work as like a packaging and export system too, as vehicles. Think of them as vehicles. They do carry to and maybe take away, and that's something that a lot of people maybe don't know about them as well. But yeah, they take out excessive molecules, damaged proteins, damaged tissues, those kinds of things, and can help take them away from the site of injury. And that'd be one of the last things that their function as. But most people just think of them as these little incredible healing molecules that take place of the skin, or they just fill in and make them look pretty. It's a lot more complex, but still in the end, they do
Some pretty amazing things.
That's awesome. And if you guys want more information, there's an episode we did, probably a couple months back on the first regenerative medicine, where we touched on the brief overview of a lot of the stuff that we're talking about today. We're just diving deeper into certain topics with that. I'll leave that podcast link in the description, so if you want to go check out that episode. But now let's dive into the actions of skin rejuvenation, just even on the skin level. How does it help with, I'm assuming it would help with collagen production, synthesis, and a bunch of other anti-inflammatory things.
And so we have some studies done, not more human trials, especially with exosomes. We have very little human trials done. There are some, but a lot of this has been just done in the lab to try to understand what it can do. And so we do know this is just one study done where they took exosomes derived from stem cells, mesenchymal stem cells. And in this certain study, it showed that they can actually stimulate collagen synthesis in these dermal fibroblasts, which eventually will become tissue. And for example, Zhang et al. Demonstrated that these exosomes increase collagen type 1 and 3 production in human dermal fibroblasts. So we do know that eventually this will obviously carry to human studies, and I'm sure we can find out, which it's funny because I already know this is happening, because if you go on any TikTok or Instagram and Google or look up exosome treatments on face, you're going to see all these before and afters. And I already know that it has this effect, but it's just funny how much more behind we are when it comes to research on anything. So yeah, we have some knowledge showing this already.
And even so if you guys don't know how big of a role a fibroblast plays, like fibroblast breaks down into a bunch of skin tissues, a bunch of tissues for helping for joints, bone, like any type of tissue throughout the body. So based on that itself, it can have a healing enhancement of not just collagen production, but many other facets of tissues, muscles, like all that stuff. Yeah, as we go through, obviously more research coming in play, there's going to be probably way more in-depth knowledge that we're going to pick up from there that I'm sure is going to help for more beneficial. I can't see anything being negative based on this being just a communicator enhancer. Time will tell with that one, but that was just one point that with the fibroblast activity is something that's, when I heard of fibroblasts, and we're starting where a lot of the stem cells actually start, and then they break down to different types of cells from there.
Yeah.
And they have a couple other effects. Obviously, the reduction of inflammation, oxidative stress. We again have another study just showing that exosomes derived from, this is human fat cells actually, mitigate oxidative damage in human keratinocytes. So anything that involving skin or hair is keratinocytes. So any damage to those cells are obviously important if we're trying to reduce damage to those cells. And then also they have the ability to down-regulate pro-inflammatory cytokines, upregulate anti-inflammatory cytokines, according to this other study. The theory would be reducing inflammation and oxidative stress can obviously delay senescence, it can delay to skin aging, it can delay anything that really would stop you from having that youthful cellular environment.
Wow.
And so lastly, we know that it can help, and this was again just one study, but promoting repair of the skin barrier. And that's important obviously when we're trying to keep the integrity of our skin maintained. So less dry skin and flaky skin, and that barrier makes a difference. Having a more like plump and volume-like skin. So when the barrier is obviously broken, we can have extracellular matrix leak out, and maybe even not even having the ability of moisture stay in. And so that's another reason to why I think this product works so well in the way that it's being used, is for that component of lipid transfer and integrating the lipid matrix to improve that barrier and improving its ability to keep moisture in and not lose extracellular fluid.
And is that must be for longer periods of time, I would assume, for the communication?
Of course,
aspect.
we theorize just how much of an effect these have once they're in the body, and it depends on where you get these from. But what's interesting is the longest living exosome in research has been shown to be taken from breast milk. You wonder why bodybuilders are wanting breast milk. They think it's just from the growth hormone that you get. But is it because they're getting 90-day supply of exosomes too? I don't know. You know, what's funny is I had a patient the other day tell me, I don't know who it was, but they got a cut on their cheek, and they took some of their wife's breast milk and put it on it, and it was like gone in the next day. And so it's just funny that could have just, some people would just theorize, that probably was going to heal anyway. But it's like, you ever get a cut on your face? It's tough to heal on the face. It takes a long time to heal your face sometimes. And to be gone in a day, I wanted to be like, oh shit, I wish I had something like that every time I've gotten like something on my face, So, but yeah, 90 days for the longest exosomes. But really, going back to the last podcast too, but exosomes, stem cells, they don't live very long in the body, especially even injected. We're talking maybe days to weeks.
Okay.
So let's just say it was days. How does this work so well, even only living for a few days in the body? It's not that they need to stay alive to get the job done. They just need to start the message, so the body starts the cascade of a reaction.
So it's almost like the igniter.
Yeah, for sure. It sets the flame on fire for it to start. It sets the...
Okay.
I always like the coach idea. So they're not playing the game. It's just giving information.
I like that.
And if a team is well coached, the head coach could go into the locker room for the rest of the game and they could do their thing. So they have the ability to send messages and then die. And that once the message is received, the body then takes that understanding and does its job.
Okay. Which would make sense on helping with the senescent cells are dying off of cells. And even as new cells die off, new ones take place. And if that messaging still stays true, obviously it would make sense for the longevity on different aspects of the body.
Absolutely.
But man, that's lovely.
Okay, let's dive into some of the clinical applications, even more so than what we've even talked about, especially when exosomes are combined with stem cells and exosomes are combined with PRP or platelet-rich plasma.
Yeah.
I think this is going to be where if you can't heal an injury, if there's certain things that original medicine can't come up with other than these weird side effects, it would make sense that all arrows would be pointing more than likely in this direction.
For sure.
A good base study for, I think, a lot of people, for most people that would use exosomes right away as maybe like a testing idea would be to just help with skin, make it look better, make it less maybe leathery looking or blemishes, maybe have more volume, maybe look younger. Those would be the kind of the entire basis of getting into the before you maybe start with exosomes. When looking at exosomes, helping with just the overall skin look, Kim et al. Investigated exosomes taken from fat cells, and they found within 12 weeks significant improvements in skin elasticity, hydration, and wrinkle depth just after topical application. So not even microneedling, which I actually recommend microneedling only if you're going to do this.
So let's walk, before we dive into this microneedling, because I know this is going to be a question.
Right. It just, if you're not familiar, it is a very small needle, penetration into millimeters of the skin, maybe centimeters at most, where think of a tattoo gun. It's maybe a good idea. A pen applicator where it's driven just into the small depths into the skin, but it's done repeatedly. And it can cause bleeding. It can cause, irritating looks, but it heals quickly, maybe no more than a week. But that helps to also drive the exosomes to penetrate the first layer of the skin and get to the portion where it can, maybe in my opinion, it helped improve the application of it. You have just topical, which this study showed all of the effects of not even doing microneedling. So I'm arguing that they might have even gotten better results. But yeah, just in 12 weeks showed a significant improvement in wrinkles, hydration, elasticity, all the things that I know every woman listening is going to want changes in.
The second would have been these exosomes taken from PRP plasma, platelet-rich plasma, which once you take the plasma out of the centrifuge, where you centrifuge the blood, the plasma is taken out. In that plasma contains the platelets, but they also contain exosomes. So that's where they're getting the exosomes. Okay. And they used this to try to treat facial wrinkles, and it showed a marked reduction in wrinkle depth, skin roughness, along with increased collagen density treating the area. And I think this was done at a similar time span for our treatment. Wow. So we are starting to see the effects absolutely in clinical trials now, but way more definitely needs to be done before we start getting a better understanding of when and how to use which exosomes. Because I know we talked a lot about that in the last podcast, but you definitely want to tailor the treatment of which exosomes you're using. A good basis would be, if you're trying to influence bone, stem cells taken from bones would probably be the best route. If we're going to be influencing fat and skin, it might be a good idea to take it from a fat cell. So blood treatments from PRP or blood, like that's the general basis. But a lot of the times we get great results from just umbilical cord cells because they have so much proliferative factors that they can usually take care of most things. But when we start to get into the actual nitty-gritty deep dive research of all of this, I would expect you to be able to choose what you get your exosomes or stem cells from. That would be the best. That would be the most effective, where I could say, hey, instead of just the umbilical cord cells that most can get, can I get it from human fat cells? Or you'll find clinics start to tailor it to yourself, where they take your fat, spin it, and then take the exosomes. But we're probably a ways away from that detail, but clinics are doing it outside of the United States.
Okay, so in terms of like exosomes, there in ways that you can apply it, there's topical in terms of cream, there's microneedling, like you said, like tattoos on how it goes up and down into the skin, different depths. And then there's injectables at, was it a site? I'm assuming this is probably with wound healing or deeper structures that you're trying to get to. Is there any others ways that we can apply that?
In regards to this, no, but they've made exosome eye drops for patients that have macular degeneration and other conditions of the eye. And so that was one place of application that's maybe different. They are...
And before we do that, if you've heard of injection of exosomes, is it exosomes?
I think it was either stems. I think it was stem cells. But
yeah, if that goes in the eye, there is one case. Doctor, I'd probably bring this up that caused blindness, but that was from our perspective.
This gentleman injected with a needle these stem cells into the eye, and it caused an issue. That was one of the only reported consequences of stem cell treatment. But again, I don't know. I would hope you never let a doctor inject something into your eye. But yeah, in this case, it's just almost like an eye drop you would if you had red eyes or itchy eyes. It's the same way. It just has exosomes in it.
Okay.
And I'm curious to see the research being done on those, because those would be incredible. Maybe reducing vision loss over time, cataracts, all these things. I don't know, but it's exciting to think about that. I don't have to go through a horrific procedure of getting the cataract sucked out of my eye, or getting LASIK, getting to cut the eyelid. These are things that if I can avoid, I'm going to want. And then the last way that I at least know is nebulized. So they can dilute it enough to create a solution that you pour into the nebulizer, and then you actually nebulize the exosomes. Great for COPD, asthma, a lot of other lung conditions.
So like for some people that don't know what that means, is it more like a vapor that helps you more absorb in the lung?
So with nebulizers, you take a solution, usually water. In most cases, they put a corticosteroid in it for patients that have asthma, usually to just reduce the inflammation that they can get. But you can nebulize a lot of other things. A lot of people like to nebulize glutathione over the time of COVID, people were iodizing or nebulizing prolamine iodine, which is just a great antipathogenic. I nebulized hydrogen peroxide when I had issues, which really just helped me with my cough, helped me with the ability to breathe better when I had COVID lung issues. And I still nebulize to this day. I love it. I think it works great. But yeah, that would be the last way that it's applied. I'm sure there are many other ways. I mean, they do epidurals with it. They do a lot of pain management ways. They do a lot of those things. IV, but the more maybe non-typical ways would be those two.
Especially when it influences the eye. You guys don't realize the in-depth of why that's exciting. Like, the eyes are part of your brain that's just exposed to the world. And just that it can affect at that level with our nervous system and have positive effects is incredible. So, okay, then that opens up the question with exosomes. What are things that you feel like it will start replacing that we're doing currently?
Exactly. And you have now like a lot of peptide creams and all of these other creams. I think they're starting to make exosome creams. So we'll see how they turn out. I know dermal fillers, for those of you listening, maybe a guy who doesn't know, I still don't know too much about all this, but there are a lot of products that are used to help add volume to the skin, whether that's lips, whether that's cheek, other places. But they actually use exosomes as the natural replacement. Because if you've ever seen exosomes in a vial, they have a viscous look to them. So you can take that and either pair that with hyaluronic acid, and that actually can then pair together as a nice scaffold. So you get the exosome healing nature paired with HA, which is a lot more viscous, and that together creates a natural dermal filler where they put that into the lips or into the cheeks or anytime you want some volume. Versus, I think, oh my gosh, I'm not even gonna remember some of the names of these other dermal fillers, but Xeomin is one, I think Kybara or Kai something is another one, but they're definitely a drug. It's synthetic, so it's probably longer lasting for the dermals, but you don't get the healing properties of exosomes with those dermal fillers, which is why I think it's a great additive. Now, the big question is it going to replace Botox? Yes. And from the providers and the experts that I've been able to work with, talk with, they have yet to find exosomes to be the full replacement for Botox. Okay. But if they can use Botox less, they're interested. Because again, we have a toxin, an actual neurotoxin being introduced into the skin. The science is and the art is relatively great now, and a lot of these providers don't have a lot of negative effects when using Botox. You can get muscle weakness, paralysis, you can even get allergic reaction. So those kinds of things can happen with Botox. You don't get that with exosomes. So that's where a lot of the providers, if they can have the same effects or similar effects and then not have to use something that's a little more risky, they're going to want that. But you'll have to use it in a way that's a little different than Botox. For example, with Botox, it can completely eradicate the wrinkles for a short period of time. You have to go regularly. Where with exosomes, if you can actually heal or remove the wrinkles, you wouldn't need it. You wouldn't need Botox. So that's my argument. Is it may take longer. You may not see the effects right away, but if you can completely eradicate it and not have to need treatment in the future, that's where I think they're going to win. So we've talked about how just exosomes can change wrinkle depth, make it look better, even start looking youthful, I guess you would say. And you have the ability to now have more volume in the skin, make it look younger, have more elasticity, make it look more pliable and puffy in a way. So you're going to get a lot more positive effects using exosomes than I guess you would use just Botox for one, maybe two reasons. Freezing the face. And I'm probably coming at it from a biased point of view, but I do know providers eventually you'll start to see natural, maybe only med spas that are just going to use products like exosomes and other things, HA, and they won't want to dive into the harsh stuff because maybe they're getting just as good results, or they have protocols to get just as good over time. And then lastly, you have synthetic chemicals, things like retinoids and hydroquinone. These are products that I think are still being asked patients to stop using because they are harsh. They can help remove blemishes, they can help making skin look a lot clearer if you do have those kinds of things. They tend to make the skin peel. It's a very harsh irritant to the skin, and over time, I think those can even result in swelling and itching, and it's a harsher chemicals.
So those are in a bunch of like chemicals, like a fragrance, and some of just like skincare products. I would
Exactly.
assume that.
And you can buy retinoid creams
Okay.
or hydroquinone creams. And I think hydroquinone has carcinogenic effects if you use it for too long. It can cause what's called, I think it's ochronosis, which is just a skin disorder. I'm not sure what it is, but those are the things that I think are tied to the label of hydroquinone. But basically, what you'll find over time, I predict, is not having the need to use such harsh synthetic chemicals, neurotoxins, all of these things. And you'll have a lot less fear of, a lot of people maybe wants to go and do these things, but they're worried that it might cause an issue, or it did cause them an issue prior, and now they don't want to do it again. Over time, I'm curious what will happen, but I do predict that you're going to see exosomes in almost every med spa clinic within the next 5 years. And if they aren't using, they're missing out for sure.
Which would make sense. And going back to reason why aren't people using exosomes and everything, obviously, I know we touched on the research and all these other small things, but even looking at the stuff that we're doing now, yes, there has been studies on it, but yes, they also know there's side effects. And it's been a norm for so long that it challenges practitioners, it challenges the population to try new things because of the question marks.
Yeah.
So when we open up the gamut of, okay, what are the options to help with this condition or that disease, looking at, okay, research or not research, what can have a better effect for you personally with the least risk of side effects. And I guess from our perspective, everything's pointing towards exosomes, maybe that itself, or mixing with another regenerative medicine model, if you will.
Yeah, for sure.
Which makes a lot of sense on just taking that step forward and asking these questions. And I think this is an awesome podcast to share this with a physician or better our knowledge as a community moving forward from there. So, Doc, let's dive into then stem cells and hair regeneration versus exosomes. And I know there's going to be a difference between those two. And I like how Dr. Addy framed the outline of this, going between exosomes and stem cells. And there's some similarities, but there's also different mechanisms of action for stem cells then versus exosomes.
So with stem cells, they have a few more functions, I guess it was maybe a better word, than exosomes. So stem cells have the ability to turn into other things, such as chondrocytes, which is just a cell that creates cartilage, which is why they're so prominent for knee osteoarthritis, because one of the main reasons that patients get osteoarthritis is loss of cartilage. So they have the ability to proliferate into the types of cells that make more of those cells, if that makes sense. I hate when stem cells are explained as they become the cell. So let's say I have a lack of bone or a lack of something, put stem cells in and they go to the area and they become it. And that's not true at all.
That's what my knowledge was before talking.
They start the process of your body making more of it. And that's important to know, because when you think that they're just going to go in and replace it, you think of it as a much easier and more simplified way, but it's not. It's going to take time, and it's a more complex way. And so you got to understand that, because if you, let's say, you don't have any cartilage in your knee, and it's like, all right, I've been putting all these stem cells in there. Why isn't it turning into cartilage? And it's trying to start that process, but it's not working. So why would that not happen? Let's say you have a crap ton of inflammation. You eat like shit. You don't work out. That process isn't starting because you're unhealthy. Versus, hey, it doesn't matter how healthy you are. I'm going to put these stem cells in there and they're going to become cartilage. No, So that's important to know why stem cells would work in a different way maybe than exosomes, and that's, you got to understand all of that. So
And you can't just rely on just the stem cells itself.
no,
That's where all these other lifestyle factors, which I know we've touched on numerous amount of times, comes into play. Food for thoughts.
you're right. If you're a smoker, you're going to have poor skin health. Exosome treatment's only going to get you so far. If you, work in an area that relies heavily on chemicals or irritants, that's tough for the body, the skin, farmers, pesticides, like all these things. If you're in the sun for a long period of time without protectant, exosomes is only going to do you so much. So it's understanding that too, because again, we still have yet to find the miracle pill, the miracle bullet. We don't have it yet. I don't know if we're going to have it. Quit waiting for it. You still got to take care of yourself. I love cells. They have the ability to turn into other cells that help then influence the healing nature of things.
So that's one thing that they do, but they also have the ability to secrete pretty much any of their own healing factors. So they can secrete their own growth factors. They can secrete their own exosomes. They are bundled up with even more healing properties than exosomes, but they also have the ability to influence. They can direct. They're definitely in the higher chain of the coach. They're the head coach. Okay. Again, exosomes would be more of the assistant coach. Okay. They're just there to communicate. They don't really direct, if that maybe makes sense, makes more sense. So when it comes to hair, the function or theory would be that they can turn into various cell types that contribute to hair follicle growth. And these can be keratinocytes, these can be, chondrocytes, not really, but more adipocytes. They have the ability to do that. So anything with collagen matrix, they have that ability to proliferate into to help stimulate and grow. So with the supportive environment that can promote maybe a more healthier hair follicle growth, when you put stem cells into that environment, it can do so. When it comes to how do we know that this even works as far as theory, we do have good research showing the effects of stem cells and how it can change hair growth or hair regeneration. So in 2015, this study was done on fat stem cells, adipose stem cells, and it improved hair density and thickness in patients with androgenic alopecia. And so it showed the enhancement of proliferation differentiated into what's called dermal papilla cells. So these stem cells became dermal papilla cells, which are crucial for hair follicle function. And so they became that. And that's what is exciting to see, is what is needed to help they become. And that's what is exciting, is maybe do we think over time as we age, we don't have as many of the important things to keep up these structures. That's where we can take this theory of stem cells coming in, becoming the things we didn't have, and then they can now create a healthier environment for the hair to thrive, or whatever you need to thrive. Second study was taken on bone marrow stem cells, which is actually interesting. Now this was done in a mouse model. So again, we don't have a lot of great human studies yet, but it did show chemotherapy-induced alopecia, that once they injected these stem cells into the area where the loss of hair was, it increased the growth phase of hair follicles. It had a higher expression of the WNT signaling, which we'll get to that signal pathway, and it showed regeneration of hair follicles. So animal model, I'm not really big on. I have a tough time with it, but again, go on to TikTok and Instagram. You will find so many providers showing such amazing results with hair regeneration. And we're talking full loss, patch, bald of alopecia and full regrowth in 3 months, I think, with 2 treatments. But yeah, these products, I think for most people listening, it maybe isn't, I don't have to sell you. I'm not trying to sell you anyway, but what I think is exciting for people is there is hope, and there are products out there that have little side effects that can actually do some crazy things without needing to take finasteride, minoxidil. Now, a lot of providers are still using those too. We'll get to that, but there could be a point in time where we don't need medication. We don't need these harsh synthetic drugs, and I think that's where it starts to get scary and interesting. And I think we might always have that barrier, because I don't know if pharma will ever allow that to happen. But until that time, it is not illegal to practice with these products. And if you are a physician listening, you absolutely can use these products without any worry. The question is just don't market it on Facebook.
Yeah.
That's it. And it's hard to build a business not being able to talk about it or explain it. There are companies out there that are good at marketing for things without actually explaining that stem cells are a part of it.
You just say it's regenerative therapies. That
Even that, you
significant
can't even say that.
Okay.
Yeah.
Well, could you say? I don't know. If
You
know.
can't. That's the thing. You can't even. There are these words that are censored, just like we talked about with they're censoring words like peptides. They're even censoring words like weight loss because TikTok hates these new peptide drugs. They're even censoring pharma, which is funny because you'd think pharma would be in part of the censoring, but no. They're censoring weight loss drugs because they don't want TikTokers to be paid, which they are. TikTokers, these 19-year-olds are being paid by pharmaceutical companies to promote Ozempic and the peptide drugs. So the kickbacks aren't even going to the doctors anymore. It's going to influencers. Doctors aren't even being paid for promoting these drugs anymore. It's Instagram, it's influencers. It's disgusting. It's fun.
Back to treatment, what really is it going to possibly be replacing is, again, the products that you've heard about before, Bosley, and gosh, I'm sure there's Hair for Men, like all these other things that have been used for, gosh, I don't know how many years. And we see some results, but when you add in exosome stem cells, it enhances it even more. And I do believe that they will get to a point where they don't even need the drug because it's just going to be that effective. And that protocol will come with a mixture, I'm sure, of PRP, stem cell exosomes, probably peptides.
Which makes sense,
And which I know clinics that do only peptide injections, they don't even do stem cells, and they get great results. Now you're going to find that I think this new basis department of medicine, RegenMed, all those things in that little umbrella are going to just outshine the competition, and you're going to find that those clinics are going to get the better results with less side effects.
Wow.
And that's where results and patient care should come from, is how can I get the best results in the shortest amount of time without harming my patient or without having the risk being as high.
Absolutely. So question for you, going back to those two studies between the study that they took from the adipose tissue and then the one they took, obviously it was mice, rats from bone. Is there a difference? And I feel like you've brought this up in the past, I just can't remember, in terms of applying this back to the body. Does it matter location site? Because I know it'll have a systemic effect to a certain extent, but do we know maybe for certain conditions, if you deliver it, maybe not at site versus at the site, the healing effects?
Yeah, absolutely.
For stem cells?
Yeah, absolutely.
So with exosomes, just let's use exosomes and stem cells.
Sure.
You can pretty much apply them the same ways, pretty much all around. But for the most part, we are starting to find where exosomes shine versus stem cells, and we're probably going to have a more understanding in the next how many years. But at the beginning, when we first started out, the whole idea was exosomes were better intravenously, and because they're smaller and they pass the blood-brain barrier. If you wanted to have that kind of effect systemically or neurogenically, they theorize that they even have a harder time going through the first pass. So for those that don't understand, is when you inject anything, as your veins take your blood up through there is a filtering system, and it can get filtered out right away. There's a lot of things that just gets removed. And so this first pass is where some theorize that 95% of stem cells injected intravenously are actually eliminated.
Oh, fascinating. Okay.
And so that's a problem when you're trying to obviously make effects on the body. But the theory is that exosomes were smaller and you didn't have as much loss after the first pass. So you would argue that, okay, if I'm trying to influence the knee, I'm just going to inject in the knee. But then you had a lot of case studies showing IV stem cells took away knee pain or other pains in the body. So it's okay, how did that work? Systemic inflammation, I don't know. But then we did find that exosomes did pass the blood-brain barrier and then could portion themselves down into other parts of the visceral areas. You found stem cells, exosomes could using markers. They would mark the cells so we could tell where they ended up in the body. They would end up in not only the brain, but the lungs. They end up in the liver, sometimes the kidneys. So we found that they made it to these areas. And so the question is, yes, the first pass maybe does happen, but they're still ending up where they need to go. And we still have a lot more research to understand before we try to use this treating a lung issue or a kidney or liver, because even though they ended up there, what does that mean?
Maybe it's just thinking of how like the parasympathetic, like your body's regulatory effect throughout the whole system, especially on immune response target areas that need work done or maintenance of work done. Maybe it just goes along that same pathway as it enhances the things that need to enhance.
For sure. And that's the good theory, right? It's getting to the areas that need healing. That could be. I don't know why it made it to only the lung, liver, kidney, and brain mostly. Like, I don't know. Could it have made it to the bladder? Could it have made it to if you have pancreas issues? I don't know. It's tough to really theorize without more research. You do your best. But what I do know is there are many patients who have, if you go into stem cell exosome research, you do find quite a bit of research showing effects on actual visceral disease. And one big study showed just one IV after a patient with a heart attack showed a 54% less die-off in cardiac cells compared to those who didn't get an IV. So it actually shows protective mechanism. I know a gentleman who, and N of one, right? So take this with a grain of salt, but I would consider him an expert in the field. He was flown in by I believe it was a Saudi family. One of the cousins was injured in a motorbike accident and was paralyzed from the waist down. This was within 24 hours. They called him. He flew over, and he was allowed. I don't even think he's not an MD, but I don't even know what background he is. Maybe DO. Anyway, he was flown over, and the first thing he told me, I got into the procedure room, and they garbed me, put me up, and I came in, and I looked at the surgeon, and the guy's, I don't know what I'm doing here. Like, the guy's, he's going to have paralysis. Like, it was an awful injury.
Sorry, the last.
Spinal cord, like, I don't even know to the extent, but to the point that they already knew that there was going to be paralysis from the waist down. Maybe even more. Plus all the other things that had happened with bone break. Like, this guy, unfortunately, was a mess. And this gentleman, he goes, they're paying us to try to save this kid, and that's what they expect. And so he goes, here's what I'm going to do. And he took out a vial of stem cells, and he poured it onto the spinal cord.
Huh.
Yeah, it was already open. Like, they were already trying to figure out what to do. And then he just poured the stem cells on. That's what he told me. And I don't know if this is a real story or not, but I do respect this man, and he has done some incredible things. And he poured it onto the spinal cord, and they did some other procedures, I think, to try to clear out debris and just everything else. They sewed him back up, and within, I think, 1 week, he had movement in his lower extremities.
What?
Now, the surgeon said there's no way that would have ever happened. I'm sure they've flown in the best of the best. So this guy's probably seen some stuff. So he wasn't expecting much. He was like, if I help this kid or not, I hope they don't kill me. I'm sure that's what this guy's thinking.
Saudi money.
At least keep the kid alive. But he's like, he had told him, he's like, I cannot believe this kid has lower limb function right now. There's just no way. There's no possible way. And I think within a month, they had him at the PT bay, and he was walking with a walker. After what I believe they called either a hemisection or almost a full, like, true injury to the spinal cord. And I wasn't there, so I didn't know what the extent of the damage was, but this is where we're getting to.
And goosebumps.
This is where we're getting to. We already showed, I believe there was already one full case report done of a man who regained, he was a hemiplegic, I believe, with stem cell treatments, he regained the ability to walk. So yeah, my story is out of one anecdotal, but we do have case reports showing that they're using this now, and we do have literature documenting that we have this ability. They're doing this with TBIs, spinal cord injuries. We have that starting to be done in the literature. So we're seeing that. So that was just something that had been done before the research has even got out.
And I know even just we touched on exosomes for just even eye drops. But
Right.
the eyes are part of your brain, part of the nervous system, like we said, exposed to the world. So just even to a certain extent, that effect on the spinal cord for stem cells is, if that story is true, is unbelievable. And it opens up so many possibilities for so many things for one condition.
Yes.
That's crazy, man.
But yeah, and a little off topic, but back to hair. Exosomes really, they have a different function than stem cells in this process. Again, they're signalers versus getting to stem cells. They don't become the cells needed for the formation of hair follicles. They just facilitate the transfer of molecules that communicate with the proliferation and differentiation of the cells needed to turn into hair follicles. So,
Exosome assistant coach, stem cells head coach.
exactly.
But this one I do want to talk about because it talks about the WNT beta-catenin pathway. So they showed this upregulation, activation of this pathway, which is crucial again for hair follicle development and regeneration, using, this was actual human dermal papilla cells. So we talked about that just a little bit ago. This was these human dermal papilla cells. They extracted exosomes from these cells. So these are primed, legit. Their function came from a cell that is important for hair. You couldn't get more to the point of making sure you help out hair. And it showed upregulation of the WNT beta-catenin pathway. So the WNT beta-catenin pathway is important. So when we talk about that pathway, what it does, and again, I'm not going to get into the full-on research explanation, definition, but in this case, this in regards to hair, it's essential for the transition of hair follicles from what's called the resting phase to the growing phase, the telogen to the anagen phase. And that's where I feel I've done enough research on that hair growth lacks when you're trying to promote hair growth. You can get the smaller hairs to grow, but they're not strong enough. And when they're at the resting phase to the growing phase, there's a lot of things needed to actually help the full growth of the follicle, the full growth follicle. So when it comes to growing hair, but if it's a thinner, not strong follicle, well, that's going to break, it's not going to grow. So not only do you need to grow follicles, you need to grow them and protect them. And that's where a lot of the proponents of the cells around the growth of the hair is important too. So making sure you reduce inflammation of the scalp, making sure that you have strong keratin of the hair, which keratinocyte growth is influenced by exosome stem cells. These are all things that if you take a look at, it's not just one thing. If you grow it quick, you're gonna grow it weak, maybe concept. So it's good that you wanna take your time to grow these hair, like grass. Do you wanna grow it in patchy or do you wanna grow it in full? That's where you're gonna take these exosome treatments and you're going to look and you're going to see that it's going to take about a year. But is that the right way, or should I just put on medication that boosts the growth, but is it going to give you that actual full filled in look, or is it going to go from a thinner to a little bit more full look? And that's where I want to get the results. I don't want to get the okay results. I want to get where I can take a full bald male and give him a full head of hair. I mean, you do that.
Not, I'm sure.
Alopecia or not, you do that, you're gonna be a billionaire.
Yep.
So that's where exosomes maybe are a little bit different than stem cells. But again, both contribute to hair incredibly. A couple of human trials I threw in at the end. This was done again, which I think I already talked about this one, but the second one was done. This was 2018, taken from PRP exosomes in treating alopecia areata. Results showed there was improvement in hair regrowth and a decrease in hair loss after multiple sessions, where I think the hair loss again comes from hair breaking because it's not strong. But yeah, so what could it replace? We talked about the two main ones were finasteride and minoxidil. So finasteride inhibits this enzyme, 5-alpha reductase, which converts testosterone into DHT. And so when you can reduce DHT, it helps to prevent hair follicle loss and particularly male pattern baldness. So that's the main reason why finasteride works so well. And then you have Minoxidil, which is a vasodilator, which widens blood vessels to improve blood flow to hair follicles. And just this specific vasodilator affects more around the hair follicle, and that's why they use it. So they use them together, like we just demonstrated. One reduces hair loss, one improves blood flow to improve hair growth, work as a team in a way. And you can use them by themselves, but a lot are using them together. Why would you want to replace them? Finasteride causes hormonal changes, it can cause gynecomastia, it can reduce libido, cause sexual dysfunction, it can cause even depression and anxiety. Minoxidil, I know, can cause irritation of the scalp. It can cause unwanted hair growth or even initial shedding of hair. So you're going to use it in ways that if you don't have to use it as much, it may be more effective. And exosome stem cells, again, just as an enhancer to this part of things.
It's unbelievable on just the effects that these things that are present just even in our bodies that can be taken out and then put back in a way to help benefit the body system.
Yeah.
Is incredible. So as we're diving into wound healing, what components does that affect action-wise? And then where are some of the applications, whether it's wound healing or ulcers? How does that look
Right.
for stem cells?
So we'll break it apart a little bit. I did do for wound healing the difference of stem cells versus exosomes, so we can touch there.
Yeah.
For stem cells, main things you're going to see them affecting is their ability to secrete growth factors like we talked about. The growth factors that they can secrete can be helpful for angiogenesis or blood flow formation, reepithelialization or just the ability to cause skin turnover, skin health, and then remodeling of extracellular matrix if there is any scarring or any other types of issues. So they do have the ability to create these other cells that go to the area and can heal. But they have the ability to also influence keratinocytes, fibroblasts, endothelial cells, which again are all crucial for not only hair, but for, like we're talking about right now, wound healing and skin. So talking about some of the studies that we've seen, this one was done on patients who have venous leg ulcers. So when patients start to lose the ability to get blood back up to the heart, if they're either diabetic or have poor circulation into the extremities, the blood can pool and actually causes ulcers in the skin. They showed that with bone marrow stem cells, it showed enhanced angiogenesis, so new blood flow formation, and collagen deposition observed. So they actually showed the ulcers were reducing in size and healthier skin turnover, collagen formation was happening. So that's great because if patients just have a tough time healing on their own, this is a great benefit or additive. Secondly, this other study was done on patients with diabetic foot ulcers. And adipose stem cells were found to enhance wound closure and reduce inflammation in patients treated with this. We do have a lot of research actually done on ulcers or diabetic ulcers. That's a great pathway. I hope it gets taken off because patients, when you have an ulcer, your chance of amputation, I think, increases by 60%. It's 40 or 60%. Yeah. It's a lot over the time of your life. So an unhealed ulcer, I should say. So if you don't heal it, your chance of it getting worse is a lot. And so when we can nip that in the bud, heal it, it's only going to help you keep your toes and limbs. And people don't understand this. Some people just really, if they don't care, they don't care. It just gets to the point, just chop it off. And it's, look, just so you know, amputees live a lot less on this earth than people with full extremities. So chop it off, but you're cutting time away from your life, like a lot of time. It really does affect your lifespan when you have amputation. So don't just treat it as they have a surgery for that. You don't understand what they're doing. They're not saving your life. They're not taking life from your future off because this isn't healing appropriately. So that's something that you got to understand. Patients need to understand that. Exosomes, they have the ability to, again, communicate, but mainly they are the ones that are transferring proteins like the growth factors and cytokines to the areas to make the changes needed. Stem cells are secreting the growth factors, exosomes are carrying it to the sites. Okay. And again, we talk a couple studies here. This was done on chronic non-healing wounds with exosome treatment exhibited significantly faster wound closure and improved tissue regeneration. That was in 2021. Secondly, this was done again on diabetic foot ulcers, but this was the exosomes instead of stem cells. But they were derived from adipose, showed enhanced angiogenesis, reduced inflammation, just like the stem cells did. So it makes sense that the same exosomes taken from the same stem cells done in those studies showed almost the same results. So should I use stem cells or exosomes? Maybe you don't have to. Maybe in that case you don't have to. You don't have to worry. Maybe or just use one. Don't worry about it. I don't know, but it's interesting to think that both had similar outcomes with similar markers measured as far as the wound closure and reduced inflammation.
So, Doc, between these two, what have you seen with some of the literature and some of the, even like the anecdotal experience that you've had with patients in the past? How many treatments would you suggest? And obviously it depends on ulcers, depends on certain other types of wounds and a bunch of different factors, but I'm assuming one and done is not the way to go with this situation.
For most, no. It might take more. It might take a lot. It just depends. But there are cases of fresher wounds with exosomes put on them sooner that show a lot better results, at least anecdotally in my experience. Again, with the case of the man talking about the laceration, who put it on right away. Yeah, it healed in fraction of the time that he was expecting. Then you have cases of scarring or pigmentation or things where the damage has been done probably for a while. That's going to take time. Hair loss, anywhere from 3 to 12 months to see results. And we're talking several treatments over that course of time. So again, it's just going to depend on what you're looking to see results in. But I have seen countless of times where patients will just get one treatment of on their face, and they do see 1 month post-treatment a huge difference. Wow. That alone, not having to wait a year to see some kind of change there, I think should, instill enough motivation to maybe want to go and do that and see shorter term results, because some people just want the short term, which I get. But yeah.
So acute versus chronic, if it happens sooner, obviously get it done sooner. Theoretically,
yeah.
What's going on, but yeah. So Doc, stem cells and exosomes in terms of like hyperpigmentation of the skin, what's the mechanisms of action and what's the differences there?
Great.
With exosomes, you have the ability of them to carry these mRNAs, growth factors, which regulate what's called melanogenesis, which is just the production or process of producing melanin. And thereby, that can then address hyperpigmentation. So when you can differentiate into melanocyte cells like stem cells can do, and then you have the ability to carry everything needed to help produce melanin in that process, that's the theory of why I would expect that to be why it's helping hyperpigmentation. But it also helps with cell turnover, create new collagen, inflammations, all these things. But those would be the two differences, I think, in theories to one versus the other for stem cells and exosomes when it comes to hyperpigmentation. As far as studies, we do have two. This was one, adipose stem cells showing reduced hyperpigmentation in patients that were in tanning beds, so UV induced. And it showed a significant decrease in melanin content and improved skin tone uniformity. So that was this one treatment done with stem cells. So what that meant was it showed a lot. So if you have this, for most patients, they understand hyperpigmentation, maybe they don't, as this blotchiness of skin that is darker than one another. And usually sunspots is maybe another name for it that you would maybe understand. So the sunspots got smaller in size and the actual skin texture improved. So that was something they weren't even looking to measure. Second was done with umbilical cord exosomes, and these patients had melasma, which again is just a very drastic hyperpigmentation. And it showed these patients had exhibited significant reduction in pigmentation and even showed improved skin appearance. So again, what we're finding is any and all skin issues probably is going to be affected by stem cells and exosomes. How you apply them is going to be the art of it, whether it's topical, whether it's injections. microneedled on derma rolled, whether it's, I don't know what they're going to do next, even vaporized onto the skin. I don't know, but I think going to be crucial for getting the healing that they never had before, and with very little, if any, side effects.
Wow. Like this, between stem cells and exosomes, just even from wound healing, hair growth, skin care, now that you guys know some of this knowledge, now it's obviously knowing where to go, searching people around you, talking to other physicians they networked. So if certain situations do come up, so let's say for that example, that story where they poured, you said, was it stem cells, right?
I think it was stem cells. He had said,
so.
yeah, it was. He'd literally just pour the vial onto the exposed spinal cord.
If that story is true, isn't by all means incredible.
Yeah.
So this is a resource. This is a tool for your knowledge that you have that you can share with friends, family, share this episode with them, share this small clip. It doesn't matter. Like, this is something that it is coming. It's a freight train that the pharma's trying to stop in some way, shape, or form. Like, it just opened up my perspective. So obviously with this episode, like, it was easy to understand, follow, especially I guess for me, but I think you described this in such a simple way, but dove into different aspects that physicians can understand this really well. So Doc, I thank you for all the knowledge from that aspect of things. And for those people that are listening at home, like, share, subscribe, comment any other questions. Like, Dr. Addy has incredible wealth of knowledge on certain other areas, especially in this field. So by all means, please. And yeah, Doc, is there any other closing remarks that you have today?
No, I think most of you who are interested shouldn't have a fear of doing this treatment. A lot of the, fear and safety around maybe these products can be explained in our last podcast, where I really dove into the safety and understanding of all of that. Before you do go to a clinic, look to see what they've done. Obviously, if they have before and afters. Take the questions of the last podcast that we talked about that I had told you to ask. Do they even know which lab they're getting from? Do they know the process of how they get their stem cells, exosomes? If they can answer a lot of those questions that I had asked in the last podcast, then you have someone who has taken the time to understand this process of extracting the product from usually the umbilical cord, and that process of then cryogenically freezing it, testing it, making sure that has no pathogens, diseases, and then storing it, sending it to clinic, and then clinic is appropriately storing it. Ask them how they're storing it. If they're storing it in a way that we've gotten to a point now where we can lyophilize exosomes in a powdered form and then just reconstitute them. Just freeze dried is maybe the better word.
Thank you.
But we can store them shelf stable now, but if they're stored as just a fresh vial, there needs to be stored in a certain temperature, usually anywhere between negative 40 degrees Celsius and up. It's very cold. That's going to be something that you're going to want to make sure that you look into. But for the most part, no, I think if you are interested in getting into this, there are plenty of people willing to put their testimonials on social media right now, and being able to see their before and afters is maybe going to help you move forward with this. But I've gotten to the point now where I'm so comfortable that I've injected it into my body intravenously, into my joints, onto my face. I've rubbed it. I think I swallowed it, maybe, I don't know. I'm not bothered by it. And again, it's just my take on it. I really have very little, if any, fear of doing a treatment other than maybe injecting it into my eye like the doctor did. That would be something I probably wouldn't do. But other than that, I'm going to continue to use these products for the rest of my life, and I can't wait for them to improve.
Just waiting as the society comes to us now, more or less. But
that was a good pod, and I appreciate everyone listening. We'll see you next time.
Woo! Let's go.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.